Let's discuss diagnosis through the ears, and let's talk about eye or ear color. Diagnosis through the ears. Although they are a tiny part of the human body, the ears epitomize the various organs and tissues of the body. All human organs and parts have representation points in the ear, revealing the physiological and pathological conditions of the internal organs throughout the body. PCM holds that the ears are governed by the kidneys and the kidneys open into the ear. At the same time, the ears are also orifices of the heart, lungs, spleen, and liver. There are abundant vascular nerves beneath the surface of the ears that are inextricably linked with the brain and various parts of the human body. The distribution of related internal organs in the ears follows some rules. In fact, they are arranged on the anterolateral section of the ears like an upside-down fetus in the womb, with the head facing down, the arms and the lower limbs facing up, and the chest and torso in the middle. Now let's go to the colors of the ears. Color changes in the ears may suggest certain illnesses. Keep an eye on the color of your ears and attend to any evident color changes. Use the thumb and index finger to pull the auricle against the light. Look straight at the auricle and observe the ear from top to bottom, then front to back. Examine it carefully, and when spotting a color change, compare it with the other ear to determine the condition. In general, white is the color of deficiency and cold, yellow is the color of dampness and spleen disease, red mainly indicates heat syndrome, blue signals liver disease, and black mostly points to kidney disease, fluid retention syndrome, and blood stasis. Regardless of what color the ears may look, bright and moist is always a good sign, while dull and shriveling is bad. Once a disease develops, the ear color changes as a result. A bright color suggests a new ailment, while a dull color means that the ailment has lasted for some time. Here is a picture of a pale auricle, and when the auricle looks pale, it indicates deficiency of both qi and blood. Rub the earlobes with your hands, and if they still look pale, it is a sign of anemia. Next, we have yellow ears. When the ear looks yellow and the eyes and face also show a yellow tinge combined with yellow urine, it is usually indicative of jaundice. Next, we have purplish red earlobe. When the earlobe appears purplish red, accompanied by swelling and even ulcers that turn into scabs easily, this is the result of high blood sugar in the body. Next we have the blue auricle. If the auricle appears pure blue, it indicates pain and inflammation in the joints. If the auricle looks so blue that it's almost black, this signals a deficiency of kidney qi and blood stasis due to a lengthy illness. Next, we have a dark red auricle. If the auricle looks dark red and is accompanied by pain and swelling redness, it indicates hyperactive heat of the liver and gallbladder or fire toxins blazing upward, which is often seen in such illnesses as eczema or otitis media. Thank you for your attention.
We continue with interviewing, still on pain. After asking about the location, we should ask about the nature of the pain. First, let the patient describe it spontaneously. Do not suggest any special terms to him or her. A potential difficulty here is the terminology used by the patient, which will obviously be different from that used in China. With experience, we learn how to translate Western expressions into the Chinese equivalent. For example, bloating indicates distension, feeling like a weight on the chest indicates feeling of oppression, feeling like being pulled down in the abdomen indicates a bearing down feeling, etc. After letting the patient describe the nature of the pain, if it is still necessary, we can then ask about the nature of the pain according to the traditional Chinese terminology, which often Western patients recognize as a very accurate description of their pain. For example, in cases of abdominal pain, we ask, is the pain accompanied by a feeling of heaviness? Many patients confirm that that is exactly how it feels. Timing of pain. After asking about the location and nature of the pain, we should then ask about the exact timing of pain. Factors affecting pain. Finally, we should ask about the reaction to pressure or temperature. When asking about the reaction of pain to pressure, it is important to formulate the questions in a way that Western patients can understand, rather than asking, is the pain better or worse with pressure, as one might do with a Chinese patient. We should ask something like, does the pain feel better if you rub it or press it, or do you actually dislike its being touched? When asking about reaction of the pain to temperature, we should also do it in a way that is readily understandable to Western patients. For example, if a patient complains of joint pain, we should ask whether that feels worse when the weather is cold and rainy. We should also inquire whether the application of heat or cold ameliorates or aggravates the pain. Chinese medicine offers a detailed classification of pain according to 5 parameters: area of pain, nature of pain, time of pain, factors affecting pain, organ versus channel pain. Thank you for your attention.
Pattern differentiation, TCM diagnosis 4. Diagnosis and treatment in the integrated TCM biomedical clinic. The following is our proposal for a step-by-step description of the process of diagnosis and treatment in an integrated medicine setting. First, gathering information. There's inquiry, palpitation, observation, listening, and smelling. Second, analysis of information from TCM biomedical perspectives. Third, integration of all clinical manifestations per TCM organ systems theory. 4, visualization of etiology, pathophysiology, and most probable interorganic relationships. 5th, establish a hierarchy of the most probable disease process at work. 6, establish the main TCM pattern of disharmony. 7, establish secondary patterns. 8, correlate all patterns. 9, establish biomedical diagnosis. 10, analyze and interpret correspondences and parallelism between TCM and biomedical perspectives. 11, design treatment strategies and prescriptions according to pattern discrimination. A, acupuncture point selection and Chinese herb formula prescription. B, complementary additional TCM treatment modalities such as massage, exercise, and diet. C, complementary biomedical treatment. 12, schedule subsequent visits. 13, follow-up and evolution of disease process. 14, interconsultation or referral. 15, other specialized diagnostic procedures such as lab tests, imaging, and others. 16, prognosis. It is important to explain to the patient how crucial their commitment to their health is in this model, stressing discipline, constancy, and self-responsibility. Depending on the individual patient's condition and needs, maintenance and preventive visits may also be recommended. Medical acupuncturists should conduct themselves according to the basic principles of the patient-physician relationship at all times. Example, with interest, trust, cordiality, amiability, honesty, clarity, security, and professionalism. Thank you for your attention.
Let's discuss the differential diagnosis on Western and Chinese medicine on Candida. Number 1, Candida albicans is a fungus which is frequently present in the mouth and vagina. When resistance to infection is low, the fungus grows, leading to oral thrust, lesions on the mouth and tongue, vaginal thrust, itching, irritation, discharge, redness, soreness, and swelling of the vagina and vulva, thick, white vaginal discharge. Number 2, causes of thrust. Letter A, having HIV infection, Candida with sore throat, muscular stiffness or aching, headache, diarrhea, swollen lymph glands, fever, fatigue, rashes. Number 2, AIDS. Having candida, fever, sweats, particularly at night, swollen glands, chills, weakness, weight loss. Letter B, taking antibiotics or steroids. Letter C, receiving chemotherapy or taking immunosuppressant medication. Letter D, being very old or very young. Letter E, diabetes. First D, type 1, candida, tiredness, excessive thirst, frequent urination, hunger, weight loss, nausea, and vomiting. Diabetes type 2, there could be a candida, tiredness with excessive thirst, frequent urination, hunger, blurred vision, slow healing, infection, obesity, impotence in men. Diagnostic questioning according to first, the organ interrelationship, the Kess cycle, a relationship between water and earth, kidney and spleen, in which the spleen restrains or influences the kidney. Consider relative strength of each organ. Number 2, candida and the triple burner. Middle burner, an impaired spleen leads to dampness and phlegm, which can throw intestinal flora off balance. Lower burner, damp and or phlegm in an imbalance in intestinal flora can lead to diarrhea and or constipation. Damp heat can accumulate in the lower burner, leading to genital discharge and itching. Upper burner, infection can spread to the upper burner, causing burning of throat and mouth lesions, altered taste. Number 3, the etiology. Diet, overconsumption of yeast products, sugar, and alcohol. Medications, antibiotic, chemotherapy, HRT, corticosteroids, oral contraceptives. An immune system or endocrine gland disorders, emotional factors, prolonged worry or pensiveness, sadness, frustration. Chronic illness and aging, environmental conditions. Sangfu patterns. For the excess, there is damp heat in the large intestine, damp heat in the spleen. For deficiency, spleen Qi deficiency, kidney yang deficiency, kidney yin deficiency. Thank you for your attention.
The vital gate. The term vital gate appeared for the first time in the internal classic. At that time, it referred to the eyes and the acupoint Jingming. It was a classic of medical problems that for the first time spoke of the vital gate as a visceral organ. What exactly does vital gate mean? Is it an organ with form and substance or a kind of function? How is it related to the kidney? Where is it located? In the literature of traditional CM, there are many opinions. The main viewpoints are as follows. Number 1 is right kidney is vital gate. In its 39th medical problem, the classic on medical problems states, the left is the kidney and the right is the vital gate. The vital gate is a house of essence, spirit, and vitality. In the male, it stores essence. In the female, it maintains the uterus. Its Qi communicates with the kidney. Number 2 is vital gate resides between kidneys. This viewpoint was first put forward by the Ming Dynasty physician Zhao Shangke. He held that the function of the vital gate was to provide genuine fire, which controlled the yang qi of the entire body. This viewpoint influenced physicians well into the Qing dynasty. Number 3 is both kidneys are vital gate. Hua Shu, a physician of the Yuan dynasty, stated, the qi of the vital gate communicates with the kidney. There are 2 names, but only one entity. Following him, Zhang Jinghue of the Ming dynasty asserted that yin and yang and water and fire both resided in the vital gate. Yin and yang mutually restrain and mutually support each other, as do water and fire. Vital gate is motive force of qi. Sun Yu Kri of the Ming dynasty held that though the vital gate was located between the 2 kidneys, it was a perpetual generative force, a pivot of vitality. Though this force between the two kidneys is the foundation of the visceral organs and the source of life, it should be thought of as fire. Though these opinions differ, there has not been any dispute that the physiological effects of the vital gate remain fundamentally the same. Most importantly, the vital gate is a source of genuine qi, the birthplace of the body's warmth and energy. It warms all the internal organs and tissue and promotes their functional activities. In addition, it plays a part in the reproductive and sexual functions of the human body. In clinical practice, deficiency of fire in the vital gate has the same manifestation as deficiency of kidney yang. In treatment, herbs that strengthen vital gate fire all have the ability to warm and strengthen the kidney. In short, for these reasons, the fire of the vital gate is fundamentally the same as kidney yang. It has been called the vital gate principally to emphasize its importance. Thank you so much for your attention.
Let's now proceed to diagnosis according to the Ranfu organ patterns with heart blood deficiency and spleen qi deficiency. Heart blood deficiency and spleen qi deficiency is a pattern very common, especially in women. The pattern can arise from heart blood deficiency or spleen qi deficiency. One pattern can lead to the other, and they will eventually become self-generating. Heart blood deficiency puts a strain on spleen qi because the spleen has to work harder to constantly try and replenish blood. Spleen qi deficiency is the post-heaven route of blood and can therefore lead to heart blood deficiency. The reason that this pattern is more common in women than men is that women lose blood through menstrual bleeding and childbirth and thus tend to be more blood deficient in general. Now let's go to its etiology. This pattern can occur when there has been blood loss, such as through heavy menstrual bleeding, childbirth, surgery, or physical trauma. The menorrhagia may in itself be due to spleen qi deficiency when the spleen is too weak to hold blood inside the vessels. The other causes of bleeding could be deficiency or excess heat or blood stagnation. The etiology of this pattern can therefore also include factors that lead to these conditions, and this pattern should be addressed in the treatment strategy either immediately or in subsequent treatments. Blood deficiency can also arise through excessive physical training where the need for blood to nourish the muscles exceeds the body's ability to produce blood. Excessive mental activity can also weaken heart blood directly, as heart blood nourishes the shen and the brain. The spleen qi deficiency aspect can arise because the spleen has to work extra hard to get more blue qi to replenish the lack of heart blood. Spleen qi deficiency can also arise independently if the diet is of poor quality or if there is an excessive consumption of food and beverages that have a cold energy or temperature or that produce dampness. If the diet lacks food that is directly blood nourishing, this in itself can lead to or worsen the heart blood deficiency aspect of this pattern. Spleen qi deficiency can also be a consequence of physical overexertion of disease. Worry, speculation, studying, and thinking too much can not only bind spleen qi and thereby weaken it, but also affect the heart. Grief, sadness, and anxiety will also be factors that can have a direct negative impact on the heart. The symptoms and signs are palpitations, fatigue, dizziness, poor memory, pale and sallow face, pale dry lips, loose stools, poor appetite, being bloated immediately after eating, insomnia, dream-disturbed sleep, anxiety, being easily startled, scanty menstrual bleeding, the person may be absent-minded or not quite present, weak or low voice, pale tongue, choppy or fine pulse. The key symptoms here are insomnia, palpitations, fatigue, loose stools, and menstrual bleeding. The treatment principle with tonify spleen qi, nourish heart blood, and calm the shen. For the acupuncture points, you can choose from heart 7, stomach 36, spleen 6, spleen 3, ren 12, ren 14, bladder 15, bladder 17, and bladder 20. For the needle technique, we tonify, and moxa is also recommended on bladder 17 and stomach 36. For the further explanation on the choice of points, heart 7, ren 14, bladder 15, nourish the heart blood and calm the shen. Stomach 36, spleen 3, ren 12, and bladder 20 tonifies spleen chi. Spleen 6 tonifies spleen chi, nourishes blood and calms the shen. Bladder 17 nourishes blood. As a relevant advice, if there is spleen chi deficiency, heart blood deficiency, and heart blood deficiency, a diet that is rich in food that both nourishes heart blood and tonifies spleen chi is recommended. This means that the person should eat a lot of green leafy vegetables, beetroot, seaweed, dates, kidney beans, aduki beans, black beans, red meat, bone marrow, blood sausages, nettle tea, heart, and liver. The food should be prepared, it is boiled, steamed, baked, and so on, and it should be eaten warm. They should avoid raw vegetables, cold drinks, ice cream, sugar, stimulants such as coffee, or too much alcohol. It is important that they chew their food slowly and thoroughly, and that they eat in calm surroundings, focusing on what they are eating. Light exercise is beneficial as it will help support the spleen chi's mechanism. On the other hand, they should avoid sitting still for long periods of time or sitting with a slumped posture, especially after meals. For a few, also be avoided because it will weaken heart blood. Heart blood deficiency and spleen chi deficiency can be caused by the following patterns of imbalance: spleen chi deficiency, heart blood deficiency, liver blood deficiency, heart chi stagnation, kidney yang deficiency, liver chi stagnation, damp, and phlegm. In turn, this can result to spleen yang deficiency, kidney yang deficiency, kidney yin deficiency, lung chi deficiency, and liver chi stagnation. Can also result to liver blood deficiency, stomach chi deficiency, damp, phlegm, heart yin deficiency, heart chi deficiency, and heart blood stagnation. Thank you for your attention.
We continue with etiology in Chinese medicine. This time we talk about the pestilential pathogenic evils. The pestilential pathogenic evils are a group of highly contagious causes of diseases. As recorded in the CM literature, it is variously called pestilence, perverse qi, strange qi, and toxic qi. Diseases caused by these pestilential evils characteristically begin suddenly, are severe, have similar symptoms and courses of progression, and are highly contagious. They also tend to develop into epidemics. The plain question states, when the 5 types of pestilence rage, everyone may be attacked through spreading from person to person. Regardless of age, adult or child, all patients exhibit similar symptoms. Such diseases may occur sporadically or epidemically. Examples include mumps, fulminant dysentery, diphtheria, scarlet fever, smallpox, and cholera. This group of diseases includes several modern epidemic diseases and severe infectious diseases. The causes of these diseases are various types of pestilential qi, but there are several other involved factors. In addition to the relative strength or weakness of genuine qi in the population, the following are also important. Climatic factors such as unusual variations in weather, prolonged droughts, extreme heat, dense fog, and noxious fumes can all foster the growth and transmission of pestilential qi and promote the development of epidemics. Inadequate environment, poor sanitation, polluted air or water, or contaminated foods also conduce to the development and progression of epidemics. Preventive and control measures such as quarantine, are effective measures for preventing the development or spread of epidemics. If these measures are not implemented in time, epidemics may arise and spread. Social factors such as war, societal turmoil, state poverty or backwardness, and unsatisfactory working environment can all contribute to the rise or spread of epidemics. So here we could see the examples of pestilential evils. Thank you very much for your attention.
The emotions, sadness and grief. Sadness includes the emotion of regret, as when someone regrets a certain action or decision in the past and the mind is in constantly turned towards that time. Sadness and grief affects the lungs and heart. In fact, according to the simple questions, sadness affects the lungs via the heart. It says in chapter 39, sadness makes the heart cramped and agitated. This pushes towards the lungs lobes. The upper burner becomes obstructed. Nutritive and defensive qi cannot circulate freely. Heat accumulates and dissolves qi. According to this passage, then, sadness primarily affects the heart, and the lungs suffer in consequence because they are both situated in the upper burner. In this illustration, the clinical picture of sadness and grief, we see a woman showing tiredness. She has a pale complexion. She may have a weak voice. There may be slight shortness of breath, slight feeling of oppression in the chest, weak pulse without a wave. The lungs govern qi, and sadness and grief deplete qi. This is often manifested on the pulse as a weak quality on both left and right front positions, which are the heart and lungs. In particular, the pulse on both front positions is short and has no wave. That is, it does not flow smoothly towards the thumb. On a clinical note, sadness causes the pulse to lack a wave. Instead of feeling like a wave flowing from the rear to the front position, it feels as if each pulse position were separate. Such a pulse is a very reliable sign of sadness. In this diagram, the effects of sadness and grief. Sadness dissolves qi. What it does to the heart is the heart qi becomes deficient, and there is qi stagnation. To the lungs, there is lung qi stagnation and qi stagnation. It dissolves the qi, and in the liver, there is liver blood deficiency. As indicated above, one can feel the normal pulse as a wave under the fingers moving from the rear towards the front position. The pulse without wave lacks its flowing movement from rear to front position, and it is instead felt as if each individual position were separate from the others. In the case of sadness, the pulse lacks a wave in the front and middle positions. Other manifestations deriving from sadness and grief include a weak voice, tiredness, pale complexion, slight breathlessness, weeping, and a slight feeling of oppression in the chest. In women, deficiency of lung qi from sadness or grief often leads to blood deficiency and amenorrhea. Although sadness and grief deplete qi and therefore lead to deficiency of qi, they may also, after some time, lead to stagnation of qi, because the deficient lung and heart qi fail to circulate properly in the chest. As mentioned before, each emotion can affect other organs apart from its specific one. For example, the spiritual axis on chapter 8 mentions injury of the liver from sadness rather than anger. When sadness affects the liver, it injures the ethereal soul. This causes mental confusion. The yin is damaged, tendons contract, and there is hypochondrial discomfort. This shows how organs can be affected by emotions other than their specific one. In this case, sadness can naturally affect the ethereal soul and therefore liver yin. Sadness has a depleting effect on qi, and it therefore, in some cases, depletes liver yin, leading to mental confusion, a sense of direction in life, and inability to plan one's life. Thank you for your attention.